when it comes to social inequality, like I'm more towards like you got to start with a level playing field, and beyond that, it's a meritocracy. I say the word
Meritocracy.
So I've been gone for a while. My English
It's
skills.
it's good. We'll let you off the hook on that, right? It's a tough word.
It's not that. It's a meritocracy. So like,
so level playing field. What's that?
Right.
What's that mean?
Everybody has equal education, access to healthy food, healthcare. Beyond that, do you? I mean, and I think that's not the case right now. And I think there's some schools that are suffering, and we don't have equal access to especially healthcare. Like I don't get why we don't have good healthcare in this country. It still drives me crazy. Like, and I get the take like, oh, I work hard for my money. Shouldn't have to pay for you to go to the doctor. You can take advantage of the system and fuck off. It's just, oh, I'm sorry, the F-bomb.
No, it's good. You invoked it, so it's over now.
All right.
We're going somewhere, right?
No, but it just makes me angry. It's just like, how can you be so short-sighted in terms of like where I lived in Taiwan again, we had a great healthcare system. And it was like some people overused it, but they liked that. It's like, oh yeah, some people take, but as long as everybody is healthy, then they could find their benefits in other ways.
What do you think keeps us from that? So just you hit on something for me that really pisses me off, and it's something we're going to agree on, even if we come from different places on it. Because I am like an accountability guy. I'm probably more rigid on that than you are, right? You probably have more empathy like in your soul than I do. You probably do, because I want people to have great lives, but at the same time I want to help them hold themselves accountable for disciplined activity. I don't want to do it to them, so I lean a little bit more the other way. That. But I am pissed off about this healthcare thing, and here's why: is that this real estate company I've built. Talk to a lot of people. They're happy that they came and did this thing with us. Talk to Lee, the person we have in common. His life is better because he met a guy like me. His life is better because he met this company. He's put the work in, but we did something different than the other companies didn't do for him. But I can't give him insurance because he's an independent contractor. So the state of Kentucky, healthcare is like state-based. It's not a federal thing. There's still state rules everywhere. But if you go to any of the 50 states, so we have almost 200 realtors, independent contractors. There's a reason why they're independent contractors. This isn't a 40-hour-a-week job. You can't do it. We're weekends, we're nights. You take phone calls. How do you clock in and out for that? The thing that sucks is I have 200 people. So I can't have a group plan that they can participate in. If you're an independent contractor, they are not allowed to be on anybody who's an employee. So the company has employees. Those 8 or 9 or 10 people that are employees, they can be a part of a group plan.
But somebody like Lee, he has to get his own.
Correct.
Okay.
I legally am not allowed. The insurance companies are not allowed, whatever it is. And here's what's funny. Whether it's a Republican governor or Democratic governor, we've had both. They don't change it. We've had Democrat and Republican Congress and Senate in the state. They don't change it.
Who benefits from this?
Who benefits? Who benefits? It's got to be the insurance companies. It's got to be the medical companies. It has to be all of them. That what makes no sense to me is like, why? It doesn't make any sense. Like, what I'd say is, I want to pay my fair share that every other employer, I will pay that. Whatever P&G pays, whatever Kroger pays for their employees to work in their grocery stores, I would contribute the same. I'm legally not allowed to do it. What the fuck? It's stupid. And so that's the issue with government and religion and all this stuff too. Logic doesn't usually enter into a lot of these big discussions. And the education piece, I don't do many nonprofit things. But I sit on a nonprofit that is really concerned about education in specifically Northern Kentucky, and then identifying the stuff happening in the river cities. So I did deep dives into being on this nonprofit. I'm trying to figure this the F out. Because it's not just about money. It's not. Because the schools that are struggling the most, they get more money per student. And I don't know why everybody keeps being dishonest about this. Newport, Kentucky. One of the worst performing districts in the entire state, if not the worst, gets more money per student from taxes than any other district in the whole area.
Really?
It's proof. And
what's causing it then?
Boy, it's a societal conversation, man.
All right.
That's what it is. And I asked tough questions, and I wasn't a very popular guy in the room for asking the tough questions because I wanted to say, okay, then why?
Right.
So for the record, in Newport, it's some of the highest property taxes as well. That's where the money comes from. So there's more money funded per kid in that school district than Fort Thomas, than Beechwood, than the public schools in Boone County and Kenton County that the kids are performing better? It's fascinating, isn't it?
Yeah.
And here's the reality of the situation. There's been Democratic mayors and there's been Republican mayors. There's people that sit on school boards and council. A lot of those people now, if they register, look at their registration. They're Democrats. So why are we having an issue in society talking about these hard, tough problems? No one wants to ask the questions. You ask the questions, you get shouted down. Yeah, I'm registered independent. I think they all suck. I really do. Because I'm like, there's no one asking these tough questions. And so what I want to know is like, if carbon's bad, all right, let's fucking change it. I did when you invoked it. If plastics are bad, create a company to do this stuff the right way. I think it does take us making some decisions like this. So that's why it's a lot of times I just go into this podcast is fun and we talk about who someone is and talk about their business. But I end up going to these places like I'm just going to go in my cave because everybody's just accepting the status quo, man. And the status quo for kids in a lot of these urban environments when it comes to education, it's not a good outcome. It's not. And for me, there's 20-something thousand realtors in the state of Kentucky. There's a lot of awesome people, man. You go through my company, there are quality people in this company that every day are getting up. Yeah, we're making money, we're making commissions, but we really have a passion for helping people like own a home and this idea of home ownership and gaining equity. And because when you own something, you have more buy-in to that thing, and there's something empowering about doing that than paying rent to someone. I don't care but that's reality. And so we're good people. But the person that's packing groceries at Kroger gets to be a part of an insurance policy, but my realtor doesn't?
Mm-hmm.
So this isn't just about equal access. I'm telling you that there's people working in my company that are making six figures that don't have access to that thing. That's fucked up.
Right. But in terms of just basic survival, in terms of just basic life, I think that there's no safety net for a lot of people here. And in terms of finances and in terms of healthcare, like it's terrifying right now if you get sick in America. America's the worst place in the world to get sick. We have some of the greatest doctors in the world, but only if you have excellent insurance or...
Is that true, though?
Yeah.
So for me, I have to have an independent policy.
So do I.
With a huge deductible.
Yeah. So do I. Well, just
yep.
But different sake. I was at the gym back in Taiwan and I threw my back out really, really bad. I went to the hospital, got all the MRI, the X-ray, the therapy, the drugs, follow-up therapy, and I spent about $50 total. And then I have some extra insurance on top of that in case something really bad happens, I get cancer or something like that. But it's really inexpensive, like $150 a month.
So how do you think we'd fix this?
I don't know. And I think it's more, like I said, it's easier, and I hate to say this, but it's easier in Taiwan because it's much more homogenous. It's 99% Asian folks, maybe 98, and with the Aboriginals there. And I think it's easier from our human nature when everybody
looks the same.
Yeah, I think it's easier that way. And I think in America we have a unique situation where we don't all look the same, and it's hard. And we do get tribalized. We think like, well, my people are doing all right, so we're good. And I think it's hard to expand that to people that don't look like you. And I think that's part of human nature. But and I don't know how to get over it.
But we spend a massive amount of money on these systems that don't work.
Yeah,
in healthcare. Look at the percentage of taxes in our federal government that goes towards healthcare. It's significant, man. The amount of money that's spent on Medicare and Medicaid for it's insane.
Well, all that's due to the ridiculous costs in hospitals. I mean, that's not. You shouldn't attack that. Doing that, you should attack the costs. And the only reason it's so astronomical is what's getting. That's why everybody goes to Canada to get their drugs. They fly. It's cheaper now to fly to like Thailand to get an operation, pay out of pocket, than it is to do it with insurance here in the States.
Are these things too big to try to fix?
I don't know. I mean, I came here to talk about eggshells. I didn't know I'd fix the healthcare industry. And I have such an ignorant view of it. Like, I'm not, again, I don't have the vocabulary or the fluency to talk about it. Right?
But I think what happens is, I think more people are like us than not. That's the issue. Like, I'm running a real estate company, making impacts in people's lives. You're doing this because you have passion around making an impact, and you're going out and do it. And there's we're normal. We're average out here we're ordinary people trying to do extraordinary things. And it's like, what about these other ideas that we consistently agree, no matter where we come from politically, no matter where we come from religiously? It's like, why can't this be dealt with and figured the F out? It makes no sense. because we're operating our businesses, but you still passionately care about equal access to things.
Right.